everybody? Dr. Eric Herman, Guru Chiropractor, back again for another video. Peace and love to everybody out there. This is Robert, my new patient. What's going on today? Welcome to coming by. How'd you find out about me again?
I got referred from one of my coworkers came to
Okay,
me. Yeah.
Cool. They said I did a good job, so
He said you helped him.
Nice, cool. So Robert's here. He's got a little lower back stuff going on. It's been happening for what, like 10, 12 years?
About 12 years. The first flare-up was about 12 years ago.
Yeah, and it's episodic, which means it happens in episodes. It's not constant all the way through, right?
Correct.
And you just had a flare-up like, what, 3 weeks ago?
3 weeks ago.
Okay. And it's bothering you more on the left side of the lower back, right?
Yes.
And you got a bunch some other things going on down there. You can't lift up your right knee a little bit. Left knee. I know it's in my notes. I got it written down. So we're gonna do a good exam. And then we'll see what's going on. If you have compression in your lower back, the best thing that I got to offer you is the ring dinger, spinal decompression plus the full body. But we'll see first. Let me go because we got to do an exam. So we're going to roll into an exam, and I'm going to check the whole spine, even though you're not complaining too much up above. I'm going to check everything anyway. And then once I'm done with the exam, we'll talk a little bit about the treatment, confirm everything, and then we'll roll right into the treatment.
Okay.
Your job, stay relaxed, and give me a heads up if anything I'm doing doesn't feel good. Okay, so I'm coming behind you. Stay right there. I'm going to check your neck a little bit, do a little exam in your neck, and then we'll lay you down and really take a closer look at that lower back. Okay, so first thing I'm feeling right off the bat is these muscles, these trapezius muscles. Now you lift. I know you're a lifter.
Yes.
You're pretty jacked up. So these are tight though, but they're still abnormally tight. They're tighter than they should be when you're just trying to sit and relax. Okay. So they're pretty fired up. Plus, we forgot to say, what do you do for work? Tell them.
I'm a truck driver.
Yeah, so truck drivers are...
35 years.
Yeah, 35 years. It's a great job, but it tears up the back over time. I know, I got a million truck driver patients. So what I'm feeling in the neck is it definitely is tight. Upper cervical's tight. Do you get headaches at all?
Yeah, but I thought it was from sleeping.
Like how, like on a regular or every once in a while?
Every once in a while.
Okay, because the most common cause of headaches is neck stress. Not the only cause, but by far the most common, and you definitely got some neck stress. So hopefully that'll help with that too, because we're going to work on clearing whatever needs to get cleared, not just what you're complaining about. Okay. All right, so let's see how well you're turning your neck. So turn as far as you can this way. It's not too bad, but see how it stops here? Okay. Perfect should go here. So you got about a 20-degree deficit on that side. Don't turn the body. Don't cheat, just the neck. See how that stops short here?
Shorter, yeah.
That should go here. So that's about a 40 or 50 degree impairment. Tilt. Yeah, so you definitely got some tightness in the neck. Even though you're not having too many symptoms up here, no?
No.
Okay. No? Good.
Not too many.
But you feel tight? Do you feel the tightness? Yeah. Bend backwards as far as you can. Yeah, see, that's jammed. Normally, you should be able to get your face almost parallel. So it's a little bit restricted. Chin down as far as you can. Anything pulling here, or does it make it pull worse down there?
No pull at all.
Okay, come on up. The point I want to make is you don't have to, just because you have no symptoms is not a guarantee you got nothing going on.
Absolutely.
Symptoms happen after you reach a certain threshold of severity. But the cool thing is when I do my exam, I can detect issues before the symptoms start to. Symptoms are like alarms. Right. Before the alarms turn on, and we can handle them then before the check engine light comes on, we tune you up so it doesn't come on and you don't get worse. Right. That's prevention, and it's a much better way to approach your health than reacting to symptoms, right? All right, now I want you to go face down. We're gonna check that lower back. So put your face here, rest your hands on the side cushions, keep your face on the paper. Stay relaxed, good. All right, now I'm gonna go back and just take a look at your posture, because posture tells me some things and also gives me some stuff to work on. So looks like your whole body is torqued to the right. The shoulders are twisted to the right, and the hips, worse, are twisted to the right. Can you feel that? Like if I try to do this, you relax, don't move, let me move you. If I do this, does that feel tight? Like does it? Yes, I feel yeah. Everything wants to go this way. So sometimes when that happens, it's something you're doing in your life where you're leaning or twisting repetitively only to one side. Like, I don't know, if you're in the truck, you're always leaning to one side, or you sleep more on one side than the other. That could do it. That could do it. So we're going to work on getting your posture more neutral, because That's when your body works its best, when it's lined up properly. Same thing with a car. When the car's tuned up, you get better function. When it's out of tune, you lose function, right? And things wear out quicker. Same thing with the body. Hips are level though, but they're twisted to the right. So now I'm going to bend up your knees, right? Normal, you should feel it stretching in your front of your thighs, your anterior thighs. Okay. However, if you feel anything extra pull here or pain activate here when I bend these up, that's not normal. Let me know. Okay, Ben. What do you feel in your lower back when I do this? Yeah, it gets tighter? Okay. Okay, and I feel it, because notice here too on your thighs. See how loose that is compared to this side? Right. So when this is tighter, it's also tighter here. Correct. The cool thing is when this releases, a lot of times this gets looser without even stretching. How do you highlight that? We'll check it afterwards. But that's a positive orthopedic test that indicates too much compression where you felt it squeeze. So already I know you got compression here. Yeah, and I've pushed down and it definitely feels tighter here. Now we'll check again the range of motion for this area. So I'm going to press down on your tailbone. Start with your left leg. Don't bend it. Keep it stiff. Lift it up off the ground, table as high as you can. Okay. All right, down. It doesn't go up too much. You feel tight? Yes. Try the right side for comparison. Yeah. Okay, go down. Twice as high, bro. So that tells me your sacroiliac joint on the left is really jammed up and tight. So we're going to put a lot of emphasis on releasing here. Okay. Now, when I press here, is it anything sore?
Just a little bit.
Yeah.
It is a little sore.
Yeah, that's an indication that there's inflammation going on in that area too. How about out here on the left? Soreness? No? No. How about out this way? No. Okay, so you definitely have compression in the lumbar spine and jamming in the left sacroiliac. So we're going to work on that. As I come up the spine, not too bad. Just, tighter than normal, but nothing horrible. But once I hit here, it gets really tight and jammed. All this. This is the transition zone between your neck and shoulders. Very big, hot spot for most people on the planet, because we're all looking down too much at the damn phones, at the computers. When we're sitting driving, we tend to slouch forward. Yep, and this gets beat up. So we're going to work on releasing here too. Okay. And then a little bit in your upper neck too. That's why I talked about the headaches. It's pretty tight up through here. Okay, so you definitely qualify for a ring dinger and a full body. That's my best recommendation. Nothing showed up for safety. It's safe to treat. So I'm ready if you are. I'm ready. All right, option 3. You good with that?
Sure.
Okay, so we're going to stretch you out first here, loosen you up, do a little massage, and then we're going right in the back room, and we're going to do the full body decompression pull. You're going to love that. You said you did way back in the day the DRX decompression.
I did. The first time it flared up. That's
yeah, and it helped you, right?
It did.
Yeah, I don't have anything bad to say about it. It works, but I will say I'm noticing since I've been doing the ring dinger pull, compared to the stats on the DRX, the ring dinger gets it done a lot quicker. It's a lot more efficient.
That's what I was going to say. It took about 16 weeks.
Yeah, that's what I hear from a lot of patients who have gone in that direction first. My patients, it's different for everybody, but even when remember back when you were first flared up here, even people like that, handful of visits, and it's resolving on a lot of people compared to 16 weeks? 16 weeks. Yeah, handful of visits over a month or two usually is the average of what a patient like that has here when they're getting the ring dinger. So not everybody, but a good percentage. Good. Good. You're already loosening. Feel that? Is it giving a little crunchy? It's already releasing. And I'm not really doing an adjustment. This is just a stretch. But is a good one. All right. Now we're going to use what's called the thumper. It's a massager that I love. Everybody loves this damn thing. If you don't like it, though, let me know. So you're owner operator? You got your own rig?
Yes, I have my own truck.
Nice. Nice.
Which makes it worse because you got to drive in order to make a living.
Yeah, because you got that overhead. People don't understand that. People think when you're self-employed and when you got a business, it's a cake, you know, and you automatically make more money. You do make more money, but you also have more expenses.
Exactly. You have the expenses of the owner.
Exactly. Same thing here. And how about this? Tell me if you relate to this. No paid vacations.
Absolutely.
I haven't had a paid vacation in 25 years.
No work, no money.
When you take off, you stop earning. So it's not as easy to take off and go on vacation because you got to pay twice. You lose money and you got to pay for the vacation. But you know what? I don't think I could be somebody's employee. I don't even think I could, really. I don't think I can handle it. I have to be free, man. I have to be free to do my own thing. I couldn't.
There's a certain satisfaction that comes with being your own boss.
Amen. Amen. So yeah, I kind of relate what I do as a tune-up to the body, like you would tune up your vehicle. It's very similar in results and application. The only difference is, if you're a human body, once you wear out a part, it's very hard to swap it out compared to a machine, you know what I'm saying? So, no, it ain't quite that easy. And mechanics charge a lot less than surgeons. Fucking, I'm sorry for cursing. I cursed. I said the F-bomb. But, so yeah, your maintenance for the body you should be a lot more gung-ho about maintenance for the body than you would be for your vehicles. Because once you wear out your body, you're pretty much screwed. Good. Now you said lifting the left knee is hard when you're putting your pants on? The left side or the right side?
The left side.
Yeah. Okay.
But it's not really the knee. It's more like the hip flexor doesn't flex.
Okay, but when you lift your knee up to it feels locked.
Yes.
Well, that's probably from here, bro.
Exactly.
So I think this is the main cause of that. We're gonna release here, and then afterwards I want you to try to reproduce that, that motion and see if you feel any better. Yeah. Good. All right. Nice. Little warm up. So when you're ready, come up on your feet. We're going in the back room where the ring dinger, the compression table is, where all the magic happens. Yep. Come up, slide up a little bit. All right, stay there. Hands up on your chest. Now I got to feel your hip bones because we got to get you lined up the right way. You're a little bit high, so slide down about an inch. Little bit. Right there. Perfect. Okay. Now the table's going to raise up. You don't got to worry. I got you. Must be 80 degrees today.
Yeah.
It's almost November.
It's crazy.
But tomorrow, rain and 55.
And the rest of the week,
yeah,
even less than
that. All right, legs are coming up. Just don't wiggle your legs. Just let them bend, though. Let them relax. Let them bend. Good. Go this way. Okay, now I got to pin you in pretty tight here above that hip bone to lock your body down. So when I pull, I don't want your body to move or very little. So it's going to be a little snug. Okay. Tell me if that's too much for you or you can handle that.
Okay.
Good man. Okay. Let me have your hands back to me. This is not the treatment. I'm just making sure there's no slack between the hips and the pins.
Okay.
Nice. And relax them again. Now the towel goes around your neck, but really it grabs the back of your skull and your jaw like this. Okay. But my hands are too small to get a good enough grip, so it gives me better grip. So let me spritz it. On Saturdays, we spritz it with a little tequila for pain relief.
Right.
Just jokes.
Cinco de Mayo in October.
That's right. Cinco de Mayo. Now, if it's too tight around the throat, let me know. It should not be choking.
Okay.
It needs to be a little snug, but not choke. You good with that?
I'm good with that.
Okay. Now listen, very important.
Okay.
Keep your teeth together, touching, but don't bite too hard. Just keep them closed so when I pull, you don't bang a tooth.
Gotcha.
Other than that, I got you on everything else. You just stay relaxed to the best you can.
Okay.
You ready to go?
Yes, sir.
Okay. Give me 5 seconds. I like to center myself, and we'll do this. You stay as loose as you can. Breathe through the nose. Keep the teeth touching. Okay. First, I'm getting a good grip. You're good. You're good. You're good. You're good. You're good. Stay relaxed. Wiggle your left toe.
Oh. That did something.
Yeah?
I mean, I felt it all the way down to my hip.
Amen. That's what it's supposed to do. That's what I want to hear.
It did.
Full spine release, one pull. How you like that?
Oh, boy.
Coming down. Now, don't get up too quick. Stay there and relax.
Okay.
No pain, though, right?
No thank you.
Very rarely do people complain that it hurts. But intense, some people feel it's pretty
was
intense.
I felt a jolt in my whole entire spine.
Yeah. Yeah. That pulled out, excuse my language, that pulled out compression that might have been there for decades. And what we're finding, one of the reasons we think theoretically, it's not proven yet scientifically, that this gets better results than the DRX. When the DRX, it holds you open,
right,
and then closes and holds you open.
Exactly.
But this one is a boom, a big pull. What happens when you get compressed for too long is scar tissue develops around the joint that keeps you. This pull breaks some of that up. The DRX doesn't have enough force to break it up. So as soon as they let you go, what happens is whoop, you shrink back down mostly.
This broke something.
In a good way, not in a bad way. Yeah. I don't like to talk about breaking when we're working on the back, but
I am good.
all right.
I'm smiling.
Before you get up, I want to do a little more release in the neck, this way and this way.
Okay.
You ready?
Yes, sir.
Stay loose. Let's see what we got going on here. Bingo. Nice. And it feels like it's rotating better too. We'll check that later. Okay. All right, done here. Come up when you're ready. Take your time, no rush, no jerky movements. And when you stand up, I want you to stop for a second and kind of check your body and tell the camera, tell me if you've noticed anything better yet, anything different.
Well, right now, sitting down, I feel like I'm looking behind me to look at you.
Yeah, so you got better rotation.
Better rotation there.
I'm telling you, that definitely, I felt it when I twisted.
I don't feel any pinch. But even just standing up, I don't feel a pinch in my left side.
And you were before?
And I was before, and I'm not now. I'm not feeling a pinch.
Bueno. That's awesome, dude. That's a good sign.
Yes.
Good. You want to try to do that, lift your knee up to put your pants on? See if that makes a difference?
Oh, that's a whole lot more.
For real?
I felt a little bit, but not as much. I mean, I wasn't able to come up this side.
Yeah. Okay, good. Yeah. Now, this doesn't really get the sacroiliac that good. It gets the lumbar spine.
Okay.
We're going to do the SI joint there even more, and then we'll check it after that, too. It should be even better. Okay. Good job, though. Sounds like you got a good pull. Go back on your belly. We got more to do there. We got more to do on this table. The ring dinger is not a complete treatment, folks out there, and for you, but it's amazing. It decompresses the spine, but the spine can jam in other directions and other angles. So now, this table, we get all that other stuff, okay? So first of all, I want to bend up your knees again. When I bent your knees the first time, did you say you felt pulling here?
Yes.
Okay. Let's do it again. Tell me if it feels better or the same. Ben. What's it feel like now in the lower back? Better. It's still jammed because it's still a little tighter on this side than this side.
But it's better.
Better than it was. That's what we're looking for. Progress. You still got that twist. Sometimes the twist comes out from the pull, and sometimes I got to get it out on this table. We got to get it out on this table. So we're going to do some more work here by doing what's called the drop technique. Push down. Boom, 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 boom. A lot of booms here. and some booms there. Okay, so the belly part drops down to give me more room. Okay, this thing pops up, and when I push down on you, it goes boom. Okay, that's why I say boom. So we're gonna release the lumbars in this direction, and then we're gonna work on the sacroiliacs in this direction. Okay, stay relaxed. Nice. Good. There we go. There we go. It's like kick-starting a Harley.
Sure is.
Bam! Good. I'm sure that's going to move better because it already feels looser. Good. That side's doing fine. Nice. Now, Zach, get down there and look at the pelvis. The shoulder's still a little high on the left, but look at those hips, man. Those hips are neutral. Those are balanced. So no more twist here. Now, let's try this one. Lift it as high as you can now. Wow. Go down. Went up twice as high. Feels looser and easier to lift. Okay, that's my indication that we did a good job here. That's my measurement. So good job here. Now we're going to work more a little bit here. Lifting up the belly. And we're going to do some push down in the thoracics. Stay loose. Good. 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 By the way, I got to tell can I tell the audience out there how old you are?
You can.
63. This guy's doing good. He's taking good care of himself. Now he's doing good with the back. I give you props. Yep. I hope I look as good as you. I got 7 years to go. Look up. Tilt to the right. Stay good. Nice. That's getting rid of this transition area. Much looser. Can you tell?
I can.
Look at that. It's moving like a champ. Okay. You're clearing out really good, my friend. Happy here. Posture corrected. Left sacroiliac is much looser. Lumbar spine is decompressed. Decompressed up here. Now roll over on your back. We got a few more things to do. All the big stuff is done, though. And it did well. Cool? Mm-hmm. Now, hands back to me. Let me have your wrists. I'm going to do a little stretch. Stay relaxed. A little stretch. And then we're going to do a little tug afterwards. And sometimes you get even more of a release in your back. Boom. Anything else release? Good. I can't really aim it, and that's really not a chiropractic adjustment because it's not specific, right. But it releases more stuff, so I don't care. I don't care. Some chiropractors comment on my videos. They're like, "You're not pure. That's not a chiropractic treatment." I'm like, "Yeah, no, I don't care. It works and it helps people and it doesn't hurt people." Anyway. Now we're going to do the toes and the feet and the arches and the knees. You good with that? Yes. You good getting your toes popped? Sure. Don't beat me up. I had one guy swing at me when I grabbed his toes. He's buried in the backyard, by the way. Just kidding. Good. Good. Nice. Now we're going to do a little yank at the ankle. Should release here, like the arch and the ankle. Maybe even get the knee a little bit better. Maybe even get more in the hip. Okay. Just give me loose, floppy leg. Loose and heavy. Loose and floppy. Good. Oh, my God. Yeah. I felt it here. And I felt it here. Good. On the left hip. Good. Amen. Amen. Drop it. Loose, 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 loose. Nice. All right. A few more things to do. Sit up when you're ready. You need my help? Swing around. Again, face the decent way. Back to full circle to where we started. Now, First thing I want to see is how well you're turning. Don't cheat. You feel like that's a little looser?
It's much looser.
Look at that. Okay, try this side. This side was the tighter side. Okay, a little bit. You're still cheating a little bit, but it's a little tight still on that side. I don't expect perfection from one treatment.
Okay.
But progress, yes.
Good.
So next we're gonna do shoulder release, elbow, wrist, fingers, both sides, and then we'll be done for today.
Okay.
Start on the left, bend up in front like so with your arm. Yep.
You're not doing the elbow, are you?
Is it this elbow?
This elbow.
This move right now is the shoulder.
Okay.
And then I do this shoulder, then I do this elbow, wrist, and then I do this. So when I get back to this way in front, then remind me about the elbow. Elbow down like this. Stay relaxed. Loose. Good. Now bend up this one. Elbow down a little bit. Good. Coming around. You okay to get this elbow?
Yeah. It's the one with the scar. Which one has the scar?
This one.
Okay, so it's the left.
Yeah. Yeah. Drop it loose. Just a little bit anyway. Relax, relax. Good. Just a little thrust. Okay. Now the wrist. Yeah. Good. Good. Relax. Relax. Pull towards you. Pull. Good. Sometimes that even gets more the elbow.
It did.
I got to be careful on that one. Yeah. Good. No elbow.
No elbow, please.
Wrist. Relax. Relax. Good. I'm going to do a little pull here.
Okay.
Good. Good. Done.
Good. Good.
That's the full body and the ring digger.
Feel good.
Nice.
Now all I have to do is try to keep this posture.
Yeah. I could teach you some stretches to do. And, you know, if you decide you want to come back for more, you know, come back for some maintenance like every month or 2 or 3. Okay. It'll keep you where you need to be and do a little stretching and stuff in between for self-care, and you should be good. Okay. Now, try to do that. Now try to do the knee again. See, after we really release that left sacroiliac.
Lift my right knee, lift my left knee.
I
showed you before.
Yeah, well, that's what I'm saying. It looked even.
It didn't even. I mean, I didn't have that range of motion.
Nice.
And you definitely didn't have that balance.
Now you don't got to bother your wife to put your pants on for you anymore. No, that's good though. That's a good relief. That's good. Good results. Really good. Feels looser and better?
Absolutely.
Amen. I'm happy that you're doing good. This doesn't mean you're perfect. Right. So you got to monitor over the next 2 or 3 or 4 days. Okay. If it gets sore, put ice on directly on. It'll help reduce the inflammation and the pain and the soreness quicker. Okay. If you get any kind of glitches, occasionally after a big release, it gets a little turbulent before it starts calming down. Mm-hmm. So if that happens to you, like there's something going on that you're not happy about, reach out to Zach, let him know. He'll tell me, and I'll call you. We'll get on the phone. We'll do a phone check-in and make sure you're good. Usually it's just part of the healing process. Okay, no problem. Any questions from you?
None. When can I come back?
That's good. When you feel it, okay, so
once a month?
It depends on what you're looking for. Okay. If after 3 or 4 days you feel very good and you're happy with how you feel, okay, then come back for maintenance in about a month before it starts getting too tight again. Month or 2 months. It's different for everybody. So you just got to monitor your body and see when you feel that gripping starting to come back. Don't wait too long after that to get back in here. Remember, we're going to try to stay in front of the problems. Okay. However, if after 2 or 3 days you feel a percentage better, but not all the way, okay, that means you probably need a few more follow-ups close together. And if that's the scenario for you, I'd recommend maybe come back next week for a follow-up. Okay. And we'll work more on that till it fully clears. Okay. And we'll just keep repeating that until you're happy with how that feels down there. Okay. Or you hit a plateau and it's not doing anything else. Okay. Sometimes that happens too. Okay. Got it? Got it. All right. Appreciate you coming by. Let's say goodbye to the audience out there. Bye, people. People. Guru Chiropractor, peace and love. Big Robert. Yep.
And it works.
And it works.
And it helps.
And it helps. He's a testimony to it. If you're watching and you're like, you know what? I think I need that. It looks like something could help me too. It probably could. Go with your instincts. Go with your gut. If you're within the tri-state area, I'm in central New Jersey, but a lot of people are coming from New York. They're coming from Pennsylvania, Delaware, even Massachusetts. If you're willing to take the ride, I'm willing to see you and do my very best to help you out. Best way to reach me is my website, retrochiropractic.com. There's a book now link there. Put your info in. It goes to my assistant. He grabs it and reaches back out to you via text. And then you guys work out questions and appointments, and you come in and see me, and I'll hook you up too. I love and appreciate everybody out there for being fans. God bless. Peace out.